our budget advocacy webinar series. I'm Elisha Giorgio. I'm the president and CEO of Global Health Council, and really excited to be doing this session in partnership with the Global Health Advocacy Incubator, and really want to thank them for co-hosting and for putting together such an amazing panel, and of course for their longstanding leadership in supporting civil society advocates around the world. So if you joined us for part one in this series, you know that we explored why domestic health financing matters. And today we're going to build on that to explore how advocates can influence the decisions that really ultimately determine whether those resources reach people and communities who need them most. I don't think I need to tell anybody on this call that right now around the world, we're in a period of really profound transition in global health financing. Many countries are facing reductions or shifts in external assistance, at the same time confronting growing health needs, emerging disease threats, and increasing pressure on already very stretched health systems. So it's really important to note that then in this environment, domestic health budgets, it's not simply accounting, right? It's not just numbers. These are policy documents. They really reflect national priorities and ultimately the kind of society a country wants to build. These national budgets determine whether children are vaccinated, whether women can safely give birth, whether communities have access to essential health services, and whether countries are prepared for the next health emergency. So when we talk about budget advocacy, we're really talking about ensuring that governments have not only the resources, but also the accountability to treat people with dignity and respect by investing in their health and well-being. And health, it's a fundamental human right, but it's not only that. It's also the foundation for everything else a country hopes to achieve. Strong economies, educational opportunity, security, prosperity, you name it, they all depend on healthy people and resilient communities. Despite those facts, we also all know that good budgets don't happen automatically and that they require really informed engagement from civil society, community organizations, researchers, professional associations, a myriad of different actors to ensure that health remains a national priority throughout the budget process and that resources are not only allocated, but also released and spent effectively and monitored for results. So that's what we're going to talk about today. And we have a great panel of advocates working across Africa and Asia who have successfully navigated many of the challenges organizations face every day, anything from communication to coalition building, tracking expenditures, and just overall encouraging greater domestic ownership of health financing. So I think there'll be a lot of really interesting pieces to learn here from these experiences, and hopefully you'll be able to think about how these lessons might be adapted within your own countries and contexts. So just a couple of housekeeping notes before I turn over to our moderator. We are hoping that there will be time to take a few questions from the audience. So I would urge you to put your questions in the Q&A feature. You can find that in the bottom toolbar. On my screen, it's in, if I click on more, it pops up. It might be in another place. You can also use the chat feature. We'll monitor those for questions and help Vandana, our moderator, cipher through them when we get to that point. The other thing I just want to say is, unfortunately, we don't have simultaneous interpretation, and everyone in this panel is going to be presenting in English. There is a caption feature where you can select a different language for captions to go along in real time with the panelists. So that is also at the bottom toolbar, and encourage you to use that if you need help translating English. And lastly, just to say, we are recording the session. We will share a link to the video in the coming days, along with any resources that our panelists want to provide. And with those housekeeping notes, it's now my pleasure to introduce today's moderator, Vandana Shah. Vandana is Vice President for Health System Strengthening at the Global Health Advocacy Incubator, where she leads a global portfolio that spans quite a few topics, including health financing, across more than 20 countries. And throughout her career, she has worked with governments and civil society organizations to translate evidence into policy, strengthen accountability, and mobilize domestic resources for health. And this experience across multiple regions really makes her exceptionally well suited to guide today's conversation. So we're so excited, Vandana. Thank you again for your partnership and for bringing together such an outstanding panel. And we're all really looking forward to the discussion. And so I'm going to turn it over to you.
Thank you so much, Alicia, for co-hosting the webinar. And I'm really excited to hear from our panelists, but also from partners from around the world who are hopefully joining into this conversation. So I just want to sort of emphasize 2 points, in addition to your introduction, that budget advocacy is more than just securing the funding. As I always emphasize, getting the money is less than, I would say, 30% of the battle. As civil society advocates, it's even equally more important to make sure that money is actually allocated and judiciously spent. And then in the following year, that it is sustainably sort of reallocated by the government and becomes a standing line item. And civil society around the world plays a really important role in this process. In fact, each of our 4 panelists is going to dig into a different phase of the budget advocacy cycle. So I'm going to take a minute to just go through the advocacy framework that the Global Health Advocacy Incubator has developed, because each of our panelists is going to, in their opening remarks, talk about one of these phases and really sort of correlate their experience with how they successfully navigated this phase. So we have the first phase, which is really around advocacy planning. Like any campaign where you're trying to pass a law or increase budget, it really requires systematic mapping of stakeholders, building a coalition, engaging the media. And that is sort of the first phase that we're going to hear from our first speaker. The second phase of the campaign is when you actually deploy and implement the campaign, where you have the influencers, the media, the coalition at work that you have built in phase 1 and fully deployed, engaging at multiple levels. And so we have the phase 1 and phase 2. But in some ways, the real meat of budget advocacy comes in also in 3 and 4, which is often ignored and is not well understood. Because phase 3, in some ways, that's the behind the scenes phase. So even after you have a budget win, say after a year or 2 of the campaigning, the real work comes in making sure that monies are actually released. And that is a big piece of work that CSOs, really are challenged by, because it's hard to navigate those halls at the Ministry of Finance or the Ministry of Health, which is to receive that funding. And that is something that part of our budget advocacy capacity training really emphasize. And we're excited to, hear from our speaker on the panel about the experiences. And the last phase is the sustainability phase, making sure that the funding is reallocated. And this only depends if the money was actually released and spent for the purposes for which it was allocated. So we're going to really hear from all of our panelists about their experience, because most CSOs understand budget advocacy in theory, but putting that in practice is much more challenging. And so without further ado, I really want to sort of turn to our panel and begin this really important conversation. We have really distinguished panelists from around the world, who are leaders in civil society in their countries and have been closely engaged in the budget process in their countries. Our first speaker, I want to introduce and panelist is Shehzad Iqbal, who is an accomplished senior program leader with over 2 decades of experience driving policy reform and resource mobilization across national and international nonprofit sectors in Pakistan and South Sudan. Currently, he is serving as health program lead for the Center for Peace and Development Initiative, CPDI, in Pakistan. So I'm going to first just turn over to Shehzad and get started. So even the strongest evidence, Shehzad, does not influence policy if it isn't communicated effectively. And strategic communications help translate complex budget issues into compelling messages for policymakers. Can you share like a campaign where, you've successfully used the power of communication, contextualized, to, obviously the challenging environment? And I know how many, challenges there are ongoing in Pakistan. So how do you cut through that clutter and make sure that the right people are hearing your messages?
Thank you, Vandana. Good morning, good afternoon, good evening, everyone. I think this is an interesting and I consider it as a right question. The question like even the strongest evidence won't influence policy if it is not communicated effectively. Uh, you know, Globally, the budget advocacy is usually considered as a technical exercise. Like you crunch numbers and you come up with the policy briefs. This is the exercise. But the reality is that no one hears you, and when no one hears you, no one acts. For us, the strategy commission is like translating those numbers, those complex budgets into messages for the policymakers, for the media, and for masses at large. Otherwise, it's going to be like a proposal that just sits in anyone's inbox. So we at the CPDI in Pakistan, after a lot of trials and efforts, we have found that the most successful communication approach is, you have to have audience specific messages, and the second is sequencing those messages. We have learned that like one size fits all never works. You have to have uh, specific messages for specific stakeholders. And instead of building like building credibility before knocking on the political doors. Let me elaborate what I'm saying. Like in a real life scenario, like we are implementing a GHAI supported budget advocacy accelerator at the Balochistan provinces. So Balochistan is the largest province in Pakistan, but it's the most resource constrained one as well. So our idea and our goal was to secure a permanent budget line dealing with CVD and diabetes in the provincial health budget of 2026 and 27. For that campaign, we have the numbers. Like NCD kills 6 out of 10 Pakistanis. CVD is the number one killer. Pakistan is spending $2.6 billion every year just to import diabetes medicine, insulin and syringes. We are leading the diabetes disease burden in the world with 35 million people in Pakistan, the diagnosed diabetics, the number, those who are not diabetics. So the number is there. But like it's the data you find in the government reports, you'll find in the international agencies reports. But converting that converting that data into actual budget, that what we were focusing was very difficult. So what we devised, our strategy was to communicate these figures to create a sort of a bridge between public health crisis into budget discussion and conversations with the policymakers and with the media and public at large, even the legislators as well. So what we did, we first reached out to the government officials. We reached out to the Ministry of Health and we reached out to the Ministry of Finance. Our first anchor. Like considering it's a resource constrained province, so we did not put our demand as something a new one, that they consider as a new burden on the already constrained budget. Like Pakistan has it has its own issues, inflation and all that, and we don't want to lose all this effort just by putting ourselves as a new idea, putting up into the budget advocacy. What we did, there's a campaign happening in Balochistan called the Healthy Balochistan campaign, run by the chief minister. So we align all of our messages with the same campaign. We told them that you have already promised of providing this health facility within the province, and what now we are asking is the actual materialization of what you have committed. Like you have said that you provide this much health facilities, and we are asking a dedicated separate line on count engaging CVD and diabetes in the province. So it's the same thing that you are saying, and now we are giving you a financially viable uh, option for what you have committed. That works really well. Our messaging, our interaction with the government structure, it really worked well. And except for one official, everyone said yes, it's something which is our problem, and we need to do something about it. Now, in the second stage, we reached out to the parliamentarian. CPDI has been engaging parliamentarians in the past, like in December last year. Because of our 2 years effort, we make sure that we got a resolution passed from the Balochistan Assembly on limiting the industrial produced trans fatty acid, as well as a ban on PHO, which was passed by the Balochistan Assembly. So we built on that, and we said that okay, this is that you have committed. This is something that you have done through a resolution. Now is the time to convert that resolution into some practical step by putting a separate budget line for diabetes and CVD. And all the parliamentarians, that we reached out to during this campaign, they immediately connected with our idea, as well as the message, because we built on something that they have already started. In the third stage, we reached out to the media. We thought that instead of sending a generic press release, let's engage the different unions, different groups of journalists that are working in Balochistan. So we engaged the largest one, the Balochistan Union of Journalists, and we engaged the largest press club, the Quetta Press Club. We took them on board for the campaign, and we sit down with the reporters and senior editors, and give them a hard-hitting angle of the health budget advocacy. That when you are saying that Pakistan has the largest adult population of diabetes, why not there is a diabetes? Why not there is a budget line in the provincial budget dealing with diabetes? When you are saying that this many people are dying every year because of the CVD, why not there is a separate budget line dealing with CVD? And it's a simple message, like all the journalists, they immediately connected with the numbers, and they connected with the whole campaign. So, so if I see all this, it's the sequencing. Instead of reaching out to the parliamentarians first, we first reach out to the health department, the health ministry and the finance ministry, because they are the ones who are the custodians of the budget, one, and they are the ones, if they understood what we are saying, it would be very easier for us to communicate everything to the rest of the people, because they are the ones who do all the budget related work. And this sequencing, it really worked well for us. uh, in addition to all these connectivity, what we did, we thought maybe we need to do a full day media workshop. And the outcome was outstanding. Like they all, they were from print and electronic, and the social media and all those uh, they signed a pledge. These 16 journalists from that were part of that workshop, they signed a pledge, and they said that it's fine. Now what we do, that we pledge that we will take this whole campaign forward by putting up some op-eds, some write-ups, maybe small audiovisual things on the social media, Instagram, and all those places. So it was a big success for us, because like now we realize that we have converted those difficult
Shazad, I'm going
numbers.
to have to interrupt you,
Yeah,
as
yeah.
okay. So, no, I want to just say that, in terms of, just with, since we have less than an hour, I think you've set a really fabulous stage, and I don't know, would just resonate some of the core messages. I think one of the hardest things with budget advocacy that you've really touched upon is how do you kind of make sure the message is getting across, as you've said, sequentially to all of the key sort of components, the health ministry, the finance ministry, the parliament, and the media. And I think one of the key things is also hitting the political nerve. aligning your message to an already existing political commitment. Because in this crowded space, we cannot, create new political components, commitments from, government. So I think that is some really important messaging. I can see a lot of amazing people from around the world joining, and we're looking forward to making sure we have time for questions too. I want to turn to our next speaker, who, Risper, who is a health systems leader with over 15 years of experience. Risper has extensive experience in health financing, immunization financing, vaccine stockouts. She leads the Kenya work on health system strengthening and financing for the Global Health Advocacy Incubator, but is also our regional lead on vaccine stockout. So without further ado, I'm going to talk about and ask Risper to talk about another key component of the campaign process of budget advocacy, which is coalitions. So coalition is a interesting, wonderful key process in budget advocacy, but it is a hard thing to build, but even harder to maintain. So I want to kind of really talk to hear from Risper about how do you build a successful coalition, but more importantly, when they engage in budget advocacy, they are all have competing interests. So how do you balance those competing interests to have a cohesive message, to make sure that there is no infighting within the coalition itself? As we just talked about, messaging is important. So when you have 20 people, that's 20 times the noise and connectivity, but it's also could be 20 different messages. So how do you manage that sort of cacophony of voices? Over to you, Rispa.
Yeah, thank you so much, Vandana. And I look at coalition building to be, transforming many individual voices into one credible voice. And it has to be credible, it has to be coordinated voice that decision makers cannot ignore at any level. And therefore, for each coalition to be very successful, and especially around budget advocacy, there have to be very, essential ingredients that will be able to bring these people together to work towards having a unified voice, a common messaging, and therefore having probably a positive budget advocacy response. So looking around what we have been able to do, for example, around the Health NGOs network in Kenya, that brings together over 150 organizations, and of course with a very wide mailing list of 1,500 plus organizations spread across the entire 47 counties of Kenya, and even work around many coalitions across many regions. You look at first a shared purpose as one of the key ingredients. Looking at, the members will not agree over everything. They will not agree on everything because each one of them is coming in with a different dimension, with a different strength, with a different input. But one thing has to be clear, that they must be united on one clear advocacy objective, because there can be so many advocacy objectives. For example, in the case of immunization, we had to look at what are we looking at in immunization. There are so many issues, but we're looking at immunization in terms of domestic resource mobilization, and looking at issues around, increasing and, enabling timely release of funding for immunization to prevent stockouts. So that was our common shared purpose across all the organizations in the coalition. But a purpose cannot be fulfilled, or rather cannot be seen fit, if there is no evidence. And so policymakers across the globe, not only in Kenya, not only in Africa or Asia, but across the globe, people will respond to credible data. What is the data that we have, so that we can be able to make our coalition very influential? We need to be able to combine our budget analysis in terms of how is the budget allocation vis-a-vis how is the implementation evidence, and looking at it around what are the community voices, is it working? So the numbers will be able to tell us what is happening around the budget, but the lived experiences will explain, and they have always explained in our coalitions why it matters, and why now, and why the need for budget advocacy, for example, around immunization. The other very key ingredient that each coalition member brings in then is the complementation of strengths. Of course, each organization comes in with different competitive advantage. They come in with very different strengths, and looking at Each organization may be coming in with technical expertise. Some of our organizations have been community organizations who bring in key community voices of lived experience, for example, around the vaccine stockout, people having to cross borders to be able to look for vaccines, and you look at it being a budget issue. Looking at the media, that we've been able to work with media organizations to amplify voices around not only, the stockout, but also the need for, increasing the budget for immunization. Looking at the complementary strength that our parliaments bring in the coalition, what is their role? It is a legislative role to be able to pass laws that are favorable, not only even to immunization, but even around, the entire healthcare budget. And therefore, the ingredient then there become the complementary strength. We complement each other. Each one comes in with what they have. They will play a distinct role. They have always played a very separate role, a very clear role, with the media coming in with key messaging, one voice, and therefore we are able to create a very strong advocacy system that we would not achieve alone if we were separate, even as organizations. The fourth and almost the last, there's a lot of coordination to be done when we are dealing with a coalition. For a coalition to be successful, because each one is coming in as an expert, and sometimes it may be very difficult because everyone comes in knowing. And therefore, we've always had to invest in very clear and very open communication across the coalition members so that we are able to have facts spread across the network, clear structures and clear roles. Like, for example, the media should be able to, give messaging that is accurate, that is curated to the people they are targeting, if it is the policymakers, for example. And, what are the opportunities? We've been able to meet frequently to be able to review the progress. Where are we? Where did we start? We started with a vaccine stockout advocacy, for example, early last year. Where are we now? And therefore, once we do this and once we are able to trust each other and to coordinate, it then becomes easy for us to be able to negotiate very difficult policy conversations at times. Finally, is persistence. In advocacy, I've always said over the years and across my various experiences in, across the health space, is persistence, because the day you plant is not the day you come back to eat the fruit. And therefore, it is not a one-year exercise, Coalition members have to be actively engaged throughout the year in the various stages of the budget cycle, during the formulation, during the implementation, during the audit phase, and all approvals, including the legislative approval, so that we are able to, track expenditure. And therefore, all coalition members then have to be very persistent, because you may not be able to, harvest that day. Someone else might even harvest who comes in way later after you. But then we look at it around, tracking and accountability, holding governments accountable, looking at what is in paper. Is it translating to effective service delivery? What are the people feeling in the community? Are people feeling that the budgets are working, for them? And finally, I would say, all those ingredients, when they remain, when coalitions are engaged throughout the year, then they are much more, likely to be able to achieve a lasting policy and financing changes overall in the space. Thank you so much.
Thank you so much, Risper, for that very comprehensive response. And I know that it's a constant balancing act, because a coalition building maintenance happens every day. And I think you've really touched upon some key points. In fact, it's a perfect segue to our next panelist, and we stay on the east coast of Africa. We jump over to Zambia, where we have Amos Moale. Amos is a Zambian public health leader, policy advocate, and civil society executive with more than 20 years of experience. He is the executive director of the Center for Reproductive Health and Education. So Amos, Risper already touched upon a very sort of key part of the process, which is, I always, with all my years of experience with budget advocacy, I always say getting money allocated at 30% of the job, getting it released and utilized in the right manner, and making sure that, if it is to buy medication, it is actually released in that same year and utilized, is 70% of the challenge and getting it. So I want to just hear from you about your experience, in making that happen. And if you could limit it to 5 minutes, I want to make sure we have a lot of people to get questions at the end. Amos, over to you.
Thanks, Vandana, and thanks everyone for joining. Good morning, good afternoon. So you actually are asking me the most difficult question, and I'll try by all means to see if I can answer it in 5 minutes. So the first thing that, like you have alluded to, is that one of the most difficult challenges is to follow up the approved amount from Parliament, if it's been approved, and then also now when it comes to the actual ministry, the funds being released on time. Once that is done, then you need to follow up in terms of the implementation at health delivery system level or at facility level. That's the most difficult part. And then secondly, I think the other challenge that we are also facing is the limited transparency in terms of information. It's very difficult to actually, for you to know whether that information that you are actually looking for the resources, if it has been released, if it has been done, because once the budget has been approved at Parliament level or at ministerial level, mainly it remains with the holder, in this case, the Ministry of Finance, to actually do the actual release. So you find that for you to get the actual information, you need to have very good relationships with either the Ministry of Finance itself or the Ministry of Health, who in this case are the implementers, for you to know that the funds have been released and the funds have actually reached the beneficiary. Once that is done, then it's very easy for you to actually now know. And then secondly, this currently, I think there has been a number of reports. We have a lot of weak reporting systems for you to actually know that the funds are actually being utilized.
I think Amos may have frozen.
Yes, I think Amos is frozen.
Amos, can you try turning off your video? Might help.
So you need to ensure that you have a chain that is the facility itself. Can you hear me?
Yes, you froze for a minute. Yeah, I think.
Hi, Elisha, can you hear me?
Yep, we can hear you, Amos. I think if you keep your video off, that'll help.
Yeah,
yep.
I've turned off the video to just make sure that the bandwidth is fine. So I was saying you need to have a system that allows you to monitor this resource from the Ministry of Finance, who are the budget holders, to the Ministry of Health, where the resource is. And if the Ministry of Health at the facility level, they have also received that fund and they're using that fund for the intended purpose. And I was saying this is the most difficult part. And then secondly, with limited transparency in the information, that is even more difficult. And then with weaker systems at facility level, it makes more harder. And then once the resource, let's say, has been released, it's now very also our role to ensure that the funds that have been prioritized are actually being used for the intended purpose. So we need to ensure that we are monitoring, we are working with the facilities to ensure that they do not reallocate those resources for other priorities, especially now that you could find that, for example, there are other emerging issues. Let me just pick an example of Ebola. Not Ebola. Even Ebola. You find that there's Ebola or there's something else. They are able to use those resources instead of using the resources for the actual priority. And that is becoming so common. So it's important that there's transparency in the information that we are getting. And then last but not least, I must say that it's also critical that we have citizens' participation, which is very much limited. Once the citizens know, then it's easy to monitor the budget, because then there's that transparency. People can start questioning and asking why the supplies were not procured or why the services are lacking if they know the actual resources that have been allocated and they have been released on time. Now, coming to us as CRHE, the first key thing that we do once the budget is allocated is that we try by all means to get the actual expenditure data. Well, it's difficult to get it, but we do, and then we try and use that and share that information either through a dialogue with policymakers, like I've said, the Ministry of Health, the Ministry of Finance, and then by the end of the year, we need to go back to Parliament and have a discussion to bring to their attention what the budget challenges we had, if the execution was on time, and if the resources that were also released was on time, so that there is that strength to follow up in the next release of the resources. Thanks.
Thank you so much, Amos, for that really succinct answer. We move to our next panel.
But before you move, can I just also emphasize that the last point I want to mention is that, you see, when you are using this, there are critical documents that we need to use for our colleagues listening. We need to use in Zambia, it's called the Yellow Book. This is where the estimates are shown. And then we also need to use the reports that are given either yearly or quarterly, because that helps you to get the actual expenditure and the release. Last but not least, we need to use the annual financial statement that helps you to see that the government did actually spend on those issues. Thank you.
Thank you so much, Amos. And I think the information you shared is really critical, because when you're doing accountability, that is not something you can just do from the outside. You have to have access to, these critical sort of budget tracking documents. The actual budget bill and the campaign, is in the public domain. And you obviously get the information that X 100,000 whatever shilling was allocated for this, but really understanding whether that money ever was released for that function and then allocated to the right department and then spent requires a close tracking. So I think all of that information that you shared is really important. Now we come to our last panelist, last but not least, Chika Four, who is the founder and CEO of the Vaccine Network for Disease Control. And Chika is a long-standing public health leader in Nigeria. And Chika will share her experience on a very critical topic, which is around donor funding. So with this really emerging dynamic landscape, as we are moving away from donor dependence to what we call blended financing, where domestic resources for co-financing have never been more important, and getting governments to really own whether it's their immunization program or their malaria program or the HIV program or the reproductive health program is even more important, because formerly some of these programs were fully supported by donors, multilateral agencies or governments. So Chika, you have a tough task. Tell us some of your experience in sort of building sustainable ownership from governments.
Okay. It is no longer news that the donor funding is depleting and the physical space is shrinking. And also Gavi, who has been a great support, apart from other donors, are also giving us a timeline to say by 2030, they're off the charts. So Nigeria has to take charge of their vaccine story in terms of funding. It is also not news that the number of children that are born every year in Nigeria is over 8 million. So those children need vaccines. So with that at the back of our minds, whenever we want to do our advocacy or talk about what are the strategies that we need to make sure that we have a sustainable financing model for health, these are the kind of numbers that need to be there. The data, the evidence need to be there and clear. And especially because we now have to resort to the parliamentarians. The parliamentarians are the ones that will pass the bill. How do you convince them to make sure that your case, immunization financing is taken seriously and the health of the Nigerian child is taken seriously? So let me give you an example. The Basic Healthcare Provision Fund in Nigeria is one fund that caters to the poor. because it's a catalytic fund that caters to the poor. Of 1% of the consolidated revenue of Nigeria is put into the basic healthcare provision fund to strengthen the primary healthcare centers through four major pathways. That is the insurance, that is NCDC, which is emergencies, and MIT, which has to do with also emergencies, and then finally MPAC, which has to do with strengthening the primary healthcare centers with drugs and all that and all that. So it has become important that this particular has to be ring-fenced. Right now, health, most of the indicators in health are not, funding in health are not ring-fenced. So for us in Vaccine Network, with that in front of us, we now go to the parliament and tell them that 8.5 million children are at stake. You have to strengthen the primary healthcare system by increasing the basic healthcare provision fund from 1% to 2%. By the time you strengthen the primary healthcare centers, it will be good for you. So examples of these expanding dedicated health financing mechanisms are very, very important. And this kind of ring-fenced funding is what is necessary to improve health outcomes. Vandana said something that I wanted to bring. So immunization funding in itself is not what we are looking at. It's what it does. What does it do? Make sure that there's health for all as much as possible. And then when we are talking about health for all, the short-term thing is whatever it is that has been budgeted to be released. So we realized that budgeting does not translate to release. You can budget anything. You can budget 200 billion, whatever it is you budget. What is key is what is released. So the point is, how do we work with government in such a way that whatever it is that is budgeted is released? And for now, as we're speaking today, we have discovered that for our project started in 2023, nothing was released in 2023 until 2024. So Nigeria had to depend on donors. But for how long? So the strategy for us is to look for a sustainable financing model. So, and the basic healthcare provision fund is a sustainable financing model. That's one. So the second one also is we have to work and support government efforts and acknowledge progress. Because many times as advocates, sometimes we look at government as if we are parallel. We are not parallel. Our job is to support government efforts. And it is very, very important that we realize that. Apart from that, as we support government effort, we must support to provide evidence and practical solutions, not just criticism. We've come to understand that being an advocate, it is very important that we use our advocacy to strengthen policies, to support policies that will change the game. And then in areas where that is not possible, because supporting policies is long-term. Right now in Nigeria, the Basic Healthcare Provision Fund at the Senate has been passed. That particular 2% we're talking about has been passed. At the House of Reps, it has passed first reading and then it's going to the second reading. What this translates to immediately is that you have sustainable funding for health. And the basic healthcare for health and around the health centers. Let's not forget that it's the poor that go to the health centers. So we must create platforms for dialogues rather than confrontation. So these are the kind of things that we have learned. So the first one I would say is that whatever it is that has been budgeted, advocates must support to make sure that those funding are released. That's one. Secondly, we must support policies and reforms that will make sure that we have first funding for health. So that is another one. And that is what advocates are doing now. Now, we must also work through champions. Champions are the most identified champions, both in all the government spaces. Like for us, at the legislative sector, we have identified champions who are pushing, who have agency, and we continue to build their capacity. Through the Global Health Advocacy Incubator, we had a meeting in Turkey, and we discovered that forming a legislative caucus is key to change. And we formed a legislative caucus in Nigeria. I want to tell you today that legislative caucus that was formed, it is critical to this bill that we're talking about. This particular basic healthcare provision bill that is moving from 1% to 2% to save the lives of our Nigerian children, to have a sustainable financing pathway that even if the donors leave, we will still survive. So for me, that is a very, 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 very critical one. But in the short term, we have to continue to push that what is in the bill, what's the word I'm looking for now? They have been budgeted has to be released. That is where we are presently. And then we're using data, we're using media, we're using everything possible to push for these two things. Okay, Vandana, am I overshooting already?
No, absolutely. I think you've made some really key points. I can already see many people resonating. I think all of your points has, strong resonance, because CSOs, I think, as we have CSOs from around the world, are seeking to engage. And I think all of you have given really practical examples of, how do you sustainably and meaningfully engage and both support and work with government, but also hold government accountable. I want to pick up one question, which I think pertains from the audience questions that are coming in from Umi Musa Umar. And I think this is an important question. I'd love to hear from a couple of our panelists. Is, as we know, political priorities often gain priority over epidemiological evidence. So how have you balanced both? Because obviously politicians respond to, the current political situation. But at the same time, all of you talked about the use of evidence, the kid that is unvaccinated, the cardiovascular health data, and the burden of disease. How do you balance the politics and the science to make sure that translates into an effective budget? Maybe a quick answer, like less than
quick answer.
Quick answer,
yes,
any of you.
Yes,
and I turn it to anybody on the panel. Shehzad, do you want to go less than a minute on that?
Okay, absolutely. The simplest strategy that we use and that really work well is like one ask, one number, and one angle. Like we shared the idea of CVD and diabetes. So we shared one number, like how many people are getting affected and what's the disease burden and what can be done about it. So, like if you give this angle to any parliamentarian, politician, the people from the health ministries, they understand it quickly. And, when they understand it quickly, there are fair chances that, what you are saying is getting accepted by everyone. So this is a quick answer.
Thank you. That's great. Anybody else wants to chime in? Any of our other panelists?
Yes. So I want to chime in here. So what we do is that we break down what we're talking about. Let me give you an example of the Basic Healthcare Provision Fund. It is the fund that caters to the poor. And that's what we tell the parliamentarian. This caters to the poor. It's only the poor that go to primary healthcare centers. You are going to save over 8 million lives once the health centers are strengthened. These are the children that need vaccines. You are taking care of the poor by this decision. So we look at it as half full. Like now, Nigeria is going through the political cycle, which is going to start very soon. But we don't look at it as half empty. We look at it as half full, because how do we translate all these things into the kind of political decision that the politician sees that will be a plus for his campaign? So this for us is the opportunity that we're talking about. Save the poor.
Thank you, Chika.
Support basic healthcare provision fund.
So I'm going to jump to another question, which I think pertains very critical at this moment in time, about what advocacy strategies have proven most effective in influencing national and subnational government to increase investment in community health and frontline health workers, and really hold governments accountable that this money is not just allocated, but also spent. Perhaps maybe I'll turn Risper, do you want to get us started on responding to that from your experience in Kenya?
Yeah, thank you, Vandana. And I think One thing that is very key in budget advocacy is about relationships. Strong evidence will open the door, but trusted relationship will keep that door open long enough to be able to influence decisions. And so to be able to bring together organizations, I believe when diverse organizations bringing in their complementary strengths around a coalition, around influencing advocacy, if they align around a common purpose, they can shape, and they not only shape individual budget lines, for example, around immunization, but they will also strengthen the culture of accountability in terms of within the wider health systems, so that the efforts are continued even across after the budget advocacy. Thank you.
Thank you, Rispa. Anyone else from the panel wants to add in on Rispa's comments?
Okay. I wanted to add that the most important thing for us, especially in our own advocacy, is to allow the leaders to lead. If it's government you're working with, you make them realize that we are supporting, but you are taking the lead. The parliamentarians, the caucus, they were leading, they wrote the letters, they did everything, they were at the forefront, we are behind supporting. So once they know that they are leading, then it's a change. And we make them realize that we are supporting government to succeed. But we never stop measuring the results.
Thank you, Chika. I'm going to insert a question of mine, which is I want everybody on the panel to answer. So what is one common mistake you see CSOs or CSO advocates make when they're engaged in budget advocacy, which you want to point out? We're talking about all the things we must do. I'd love to hear just one very quick answer from all the panelists. And I don't know, whoever wants to go first on something they've realized is not strategic or productive. So maybe Shehzad will maybe go in the order you spoke.
I will start, Vasvana. Should I start?
Yeah.
Yeah, sure. So I think for me, it's the competition that CSOs have. Once we eliminate competition, I think we will do much better. One voice makes us win together. Thanks.
Thank you. That goes to the heart of coalition. I saw Shehzad, you're ready with your advice for everybody on this conversation.
Thank you, Vandana. I think the biggest mistake that CSOs make is, they start to create new things. So CSOs should always do things based and connect it with their past connectivity with the legislators, with the media, and your past work. That really works well because, if you start doing something new, it takes a lot of energies, it takes a lot of time.
Thank you. Like really strong foundation. Rispa?
Yeah, one of the very common mistakes is many a times focusing only on the budget allocation and not the budget execution. And this is because, securing a budget line is very important. It is key. It's a celebration. But if the same funds are not released on time, if the funds are not reallocated, if the funds are not spent effectively, communities will not see or rather receive better services. Thank you.
Okay.
Chika?
Okay. Yes, I wanted to say that in my own, I see accountability as strengthening government performance rather than assigning blame. I think for me, that is one thing that we really need to know the difference between the advocacy opens doors, knows the difference between advocacy and activism, and know when to use any. So many times we are activism and then we close the door permanently. We can't even enter. So advocacy to reach a goal, And then accountability is seen to strengthen performance. It's not to blame or assigning blame. So I think those are the things that I think really works. Yeah.
So I think this conversation could easily go on for another hour, but I want to just really, I think, Chika, that's a very important note. I think all of you resonated some of the key points, really making sure that you are sticking to message, keeping the coalition, but really also making sure that you're holding government accountable. And I think the word accountable is something I think, I think some of our participants have resonated, that accountability means a dialogue and partnership with government and not blame or pointing fingers. Because in the budget process, it is very hard. I think one of the questions we did not get to is, how do CSOs get access and build a relationship with the finance ministry? And I want to say in the last, 15 plus years of working with CSOs around the world on budget advocacy, one of the hardest things to navigate is how do you build access and credibility with the finance ministry. Most CSOs have been working with the Ministry of Women and Children or Health or food, and they do not have access and face time with the Ministry of Finance. And I think when you build that relationship, you have to really make sure that you're using it credibly to be working as a partner in holding government accountable and able to access the data. So I want to just say that this discussion, I want to thank this fabulous panel from around the world, from Pakistan, Nigeria, Zambia, Kenya, all countries that are facing immense budget challenges as all of our participants. And I want to just thank them for sharing their knowledge about, all of what budget advocacy requires, the technical knowledge, the partnerships, communication, continuous monitoring. While each of your contexts is different, wherever you are joining from across the world, these core principles that we heard from our panelists are applicable and contextualized within the budget cycle. With that, I just want to again sort of thank all of you from taking out time, to join us and enriching our conversation. And we hope that we can continue this dialogue and hear from you. I want to once again just thank the Global Health Council for partnering with us and putting this event together. And now I turn over to Alicia for closing remarks.
Thanks so much, Vandana. What an amazing panel. So much knowledge. And I agree, we could probably have this session go on all day for 8 hours or more. And I know there were a lot of questions, really good questions from participants, which we didn't get to all of them. We will share a recording of the video and also some additional links and information that hopefully will help answer some of the questions we didn't have. GHAI has a lot of great materials around budget advocacy, and we'll make sure that those go out to you with the recording in an email. So thank you all so much for joining us today, and thanks to our panelists and Vandana and the Global Health Advocacy Incubator team. Really great discussion, really timely. We will, Vandana and I will talk and see if we can do more of these, maybe deeper dives into each of the topics. So thanks again, everyone. Have a wonderful day and keep an eye out for an email with recording and additional information. Thank you, panelists. Take care.
Take care.
Thank you. Thank you so much.
Bye-bye.